guys, Dr. Heaton here at Carl Muscle Joint Clinic, and today I want to talk about diagnosing hip pain or hip-related pain. So I'll kind of walk through, and the information I get is from a systematic review that takes a bunch of studies, looks at the results and the methods, and kind of combines the results and sees like maybe some of the common denominators of what has been useful in diagnosing hip pain. And so they found, actually, what's very interesting is like the actual physical tests are better for ruling out hip pain than ruling in hip pain. Meaning, just because you have a positive, like a diagnostic hip test of like testing internal external rotation, and let's say you have a positive, like it hurts doing that, doesn't always necessarily mean it's coming from the hip. But if those are negative, that means it's better ruling those out. So it's better for ruling those out. If those are negative, then it's most likely it's not coming from the hip. But just because they're positive, it's not as efficient or not as reliable on using those as ruling in the hip pathology. Just because they're positive doesn't mean it's coming from the hip. So I thought that was pretty interesting. We used to think that, oh, it's positive and you have multiple positive tests, that increases the likelihood that it's coming from the hip. That's not always the case. And I actually found that, the patient interview part, where I'm actually asking the patient questions about, history, family history, have they ever had this hip pain before, it can be more useful for ruling in the hip pain. So what that means is, let's say I asked, like, it seems pretty simple, but just asking the patient, have you ever had hip pain before, or have you ever had hip osteoarthritis or an injury to the hip, is a better indicator of ruling in an injury, which seems like, well, duh. But you see a lot of clinicians will actually, and patients will kind of skim over that and not really think about that as related to their current hip pain. And also just asking family history of hip osteoarthritis. Let's say they've never been diagnosed with anything, but they do have a family history of hip-related issues. That could be a better indicator, okay, maybe this is actually coming from the hip, and that can drive our treatment in the future. So yeah, that's pretty much all I want to talk about, is just how important it is to do a thorough history and also do the physical tests, and how diagnosing hip pain doesn't have to be this scary thing, an overwhelming thing. It can be simpler than that. Not saying it's always easy, but it can be simpler than that, and how certain questions can help drive us towards what we're looking for from a patient, and how just listening to a patient is really important in diagnosing not even just hip pain, but any sort of pain or discomfort that they're having. And some other things that another thing that I forgot to mention that was shown was not only the question asking, but also do they report pain in the groin and front part of the thigh. That's another good indicator that it's probably coming from the hip joint. Some other ones that weren't as useful but they still are maybe indicators, are self-reported limited range of motion in the hip. So they feel a difference in their hip range of motion. They feel like, let's say, the right side is more restricted than the left side, or vice versa. And then also constant, buttock or back pain, low back pain, groin pain on the same side of the hip that's been bothering them. And then also just like questionnaires, like a screening questionnaire, pretty common. So yeah, hopefully that was helpful, guys, and then stay tuned for the next one.